Continuing our discussion on AIIMS May 2017 question paper, today we should go into 2016 November after this. So can you please punch whether the voice is loud and clear, everyone? What is this bacteria which is being shown in this slide is a favorite question of the examiner. So it is the Nocardia asteroids. Last time also, November 2017, examiner has asked a question as to how to recognize a sharply angulated mycelia of which fungus, acute angled one, if you remember. So definitely in examiner's question bank, recognizing the slide, looking at the slide, recognizing a fungus is there in his question bank, which you have to be doubly sure to reinforce. So this is the Nocardia asteroids, the gram staining and the acid fast staining is how you basically recognize. Nocardia as a genus is a weakly staining gram positive, catalase positive, rod shaped bacteria, and it forms partially acid fast beaded branching filaments, and it is actually a bacteria, but it acts more or less like a fungi is what you need to basically appreciate. Now, what is the disease which is caused by the Staphylococcus aureus, which is not a toxin mediated one? All of you know very well that gram negative organisms produce endotoxins, gram positive produce exotoxins. So now the question is, which is not toxin mediated? Food poisoning of Staphylococcus is within 6 hours. What is the reason? Preformed toxin is there. So it is toxin mediated. Toxic shock syndrome, नाम ही बोलता है वो toxin mediated है. Staphylococcal scalded skin syndrome is also toxin mediated, but not the septicemic shock caused by the Staphylococcus is not the toxin mediated, is what you have to fundamentally remember. A 2-week-old infant has conjunctivitis, which later he developed respiratory distress, bilateral lung infiltrates, increased WBC count. What could be an organism that can lead to a neonatal pneumonia? At the same time, a neonatal conjunctivitis is what examiner is trying to ask you. A quick clinical vignette, which you should be very sure about. It is the Chlamydia trachomatis, which is the most common sexually transmitted disease globally. It leads to trachoma, adult inclusion conjunctivitis, neonatal conjunctivitis, and infant pneumonia with a 2 to 3 week incubation period typically. And it also leads to the formation of bilateral infiltrates in the lung in an infant is what you have to understand. You are seeing the egg. Dekho, doctor. Helminthic eggs, parasitic infections and their eggs. एक मसाला टॉपिक है. नीट पीजी जाओ, FMGE जाओ और जिपमर जाओ, कहीं भी जाओ. What floats, what sinks, what is the type of staining of the various eggs? That eggology, you have to be 100% sure to win the exam. So what you are seeing is Ancylostoma duodenales. Egg is what you are able to see here. So to look at the hookworm infection, the most important thing is to identify the X in the stool is the most common method for diagnosing the hookworm infection. That is the whole paradox of our life. Even if the disease is eradicated also, still how do you diagnose is like a quiz question. Kaun banega PG Pati continues in the examiner's question bank for a period of time, right? So what are all those helminthic eggs that float in the saturated salt solution is a favorite question of the examiner. you can remember feather light. F is fertilized eggs of ascaris. E is enterobius vermicularis. A is ancylostoma duodenale. T is trichuris trichura. And H is Hymenolapis nana. They are the feather light, so they will float. Some stupid way of remembering, but it should be remembered. What eggs float in saturated salt solution? Once more, this question is going to come in the AIIMS November 2018 also. Paper out. You are going to remember me while answering this question, right? So, parasitic infestation and parasitic disorders and infections and the stools. Today evening only you should revise. Which is this protozoa whose life cycle has been shown to you classically in this given illustration? It is the entamoeba. Tetranucleate cyst is a very important clue for you to recognize. It is entamoeba histolytica. So a tetranucleate cyst is ingested by the humans from the contaminated food, and the encystation occurs in the human small intestine. That will create a trophozoite, and the trophozoite can lead to asymptomatic colonization or a amoebic colitis, or it can lead to development of the liver abscess, amoebic liver abscess. But the trophozoite also will undergo encystation in the colon, and from there it will go back and excrete in feces. This is how the amoebiasis of all the idli dosha that we eat in the medical college mess, we end up with tell me one medical student who didn't have amoebiasis attack during 5.5 years medical school. Unless you are a day scholar coming from home, packing your mama's food, that is different story. But most of the hostlers, amoebiasis is a part of the game. So what is this helminth? Is a very important question. Which is where you can see a snail over here, which is involved. So what is this organism? Fasciola hepatica. So typically unembryonated eggs pass into the feces, Fasciola hepatica. Embryonated eggs get into the water, and the mirazidium hatches out. It went out of live stream offline guy. Call him. Yeah, it is coming back, I think. Is the stream back? Okay. Yeah. Okay. Sorry for a short interruption. Is the stream okay for everybody? Are you able to get the live stream? Can you please punch whether you can get the stream properly? Sometimes there will be few absent features in the YouTube broadcast. Okay. So unembryonated eggs pass in the feces, embryonated eggs go to the water, and from there the mirazidium larvae appear in the water, and the snail, they will stay, is the one which will be hosting it, and ultimately the free swimming cercaria come out of the snail and they will be sitting on the vegetation. And if you happen to consume the food, then it can enter into the humans, and it can go to the metacercaria of the vegetation. Typically they become ingested, and they will be existing in the existation occur in the duodenum. From there they go into the hepatic biliary ducts. That's how the Fasciola hepatica passes. And some of the unembryonated eggs, they pass into the feces, and the cycle continues. So mirazidium larvae, the snail as a part of the life cycle, and sometimes incidentally even the animals which consume that vegetation which is contaminated with the free swimming cercarial eggs, even it can have one life cycle inside the buffalo and animal, and that way also it can come out. Just like humans, even animals also can be able to help in spread of the life cycle is what you need to remember. Wet mount of the scraping from the genital ulcer of a sexually active female has been shown to you for you to make a diagnosis. Wet mount, sexually active, even you don't look at the what you call the organism, you can think possibility of what could be the possible organism. So it is the Klebsiella granulomatis which is responsible for the granuloma inguinale, and it is the one which lead to a granulomatous lesion of the skin and the genitalia. Donavaniosis is the one which you need to basically remember.